Okay, good morning, everybody. Welcome to Talk Tuesday, May 27th, our final Talk Tuesday of the 2024-2025 school year. Hard to believe and hard to say that. But we hope everyone had a great Memorial Day weekend and just spent some time just relaxing and rejuvenation and getting ready for the summer is on the horizon. And I know it's a rat race until the end of the actual school year. So we acknowledge a lot of you have a lot to do as we move forward. So we will hopefully have a great presentation today. We have a lot of great content planned and a lot of great conversation. So let's get moving. And welcome, everybody. I'm Christine Killowind from the State Education Resource Center. I'm here also with my colleague, Holly Ryan. We are also joined by our CSD partners and colleagues, Kari Sullivan Custer and Jay Brown. We have today Attendance Works joining us, and a lot of you have interacted with Attendance Works before, have seen them in various presentations, webinars, so I'm sure their name and faces are very familiar. So they're going to bring us some content on strengthening the summer bridge to support increased attendance and engagement. And we are here with Emma Herden and Elliot Atisha, and they are senior fellows at Attendance Works. I'm just going to do a very, very quick wrap up at the end, just to provide you some information. Just so you know, today's a little bit of a special Talk Tuesday. We are going to have the main content within the hour that we're here, but Emma and Elliot ourselves are going to stay on an extra 30 minutes for some Q&A, some conversation. So if you can stay, willing to stay, would like to stay, please join us. Bring your questions, bring your comments, and your thoughts. We'll be here to support that. But we also understand that some people cannot stay. That you know you have too many pressing things going on, and that's fine too. The only thing is we're not recording that 30 minutes at the end. But you could always send questions and answers to us via email if you would like. And so just our Superintendent's Digest, the QR code and link are on the slide. Not too much, but there were some things I wanted to kind of bring forward to let you know that there is an intent to apply for the Strengthening Career and Technical Education for the 21st century. It's one of the Perkins grants. So the application is on there if you're looking for it. There's a fourth annual staff appreciation digital backpack program. One of the things, and Kari has mentioned before, it might be somewhere today, but the education has, CSD has put out a public service announcement on finishing the year strong in schools together and every day. We have sent that in an email to you a few weeks ago, I believe. But if you would like that YouTube clip, it is right here with our commissioner, Charlene Russell Tucker, being a big part of that. There's also some victim rights service forms that are posted. There is a professional learning needs survey that did go out. CSDE is kind of looking for, some of the needs that might be out there and how to kind of capture what professionals might be needing. So that's a great one to even check out. And for anyone, but especially charter schools that are here, we have the Charter School Best Practices Memo and Annual Report that has been posted. It's for 23-24 school year. It is that kind of 1 year behind, but a great report to check out. And just a little reminder that we have our Talk Tuesday survey. I will be putting the link inside the chat box. Please, if you have not already, please fill it out. It gives us such great information that we're able to really capture where you're at, where your team is at, what you're feeling about Talk Tuesday, the topics presented, the content, and the strategies. It gives us really a great lens into the needs. So please take a minute. It should only take a minute or two to fill out, and we would greatly appreciate it. Okay, I'm going to now turn this over to Kari Sullivan Custer.
Thank you, Christine. I'd like to thank Christine and Holly Ryan and Jay Brown for a year's worth of hard work on Talk Tuesday. This is our last Talk Tuesday for the year, and it is the culmination of 5 years of Talk Tuesdays. I can't believe that, but so I wanted to share that and to thank our team for the planning and all of the logistics and helping us through all of this. And thank you all for coming. We really appreciate. We learn from you every time we get together. So I had to create this slide for a national webinar I was doing around the 50% challenge, which is a national challenge Attendance Works is involved with to reduce chronic absence by 50% from 21-22 to 26-27 within 5 years. And so Connecticut, I want you to see this progress because I was proud of it. And I wanted you to see that we were at 23.7 at the end of 2022. And our goal is to be under 12%, 11.8 in 26-27. And as of last year, the end of June, we were at 17.7. So we already reduced our chronic absence by 25%. And we saw the blue line is 21, 22. So you see we're really high up at 26.1, 23.7. And the orange line is this year. And all of you know that we really struggled in February and January when we started to see our chronic absence rates go up. A lot of that we know is because of the sickness. A lot of people were sick. The respiratory illnesses were higher than they've been in 5 years. And so we are pleased that we've seen a steady decline from February through April, from 20.2 at the high to 18.7. And we really want to finish the year strong. And so the next slide, please. So to do this really took mid-year recovery, and the districts I spoke with really were focused on how do we finish this year strong? What can we do? And even the commissioner, she was like, how do we finish strong? And so I put a link here to her Finish the Year Strong PSA. I don't have time to play it now, but it's wonderful, and you're welcome to share it with your families. We're seeing many districts reduce their chronic absence towards the end of the year, and that has to do with your end of the year outreach, increasing family and student contact, enhancing engagement, making school more appealing. Through the spring months, we've done lots of Talk Tuesdays with different districts sharing their interventions and incentives, and it's been a lot of fun. And I thank all of you who have done that. And then your attendance initiatives to promote value of being present. Remember, school is better with you, and all of those resources are available on our website. We actually still have banners. If anybody is interested in School is Better with You, let me know. And with that, I'm going to turn it over, I think, to Emma at this point. Oh, no. I had promised in our planning session that I would put this up here for you. These are our CSDE resources for attendance and engagement. And I just thought they're a nice supplement to the presentation we're going to hear from Attendance Works. So thank you, Emma and Elliot. I'm going to turn it over to you. We're so pleased to have Attendance Works with us today. I hope you enjoyed the presentation.
And thank you, everyone. Thanks so much, Karen, to your leadership team. Really glad to engage with all of you in the conversation today. And again, given the place where we are in the year, we so appreciate your time and your attention to our conversation today. So Elliot and I are happy to lead this conversation today, and we wanted to engage with you around thinking and reflecting on not just finishing the year strong, but taking a year-long approach. And so let me share slides and we'll get going with that. And Elliot is here, but he's going to be off camera. So we'll get him. Christine, if you let me share slides, we would really appreciate it. All right. I hope everybody's able to see my deck. Yes? All right. Thank you. Wonderful. All right. Today, we wanted to engage with you in taking this year-long approach to attendance and engagement, explore some of the relationship-based strategies to strengthen connections with students and families. Again, not just thinking about how we end up in a strong place for as we wrap up the school year, but as we think about summer and really readiness for day one. Then learning about the connection between health and attendance. So Elliot will lead us into that conversation, and then identifying some of the health-related tools and resources that can improve attendance and really promote that healthy learning environment. All right. Everybody's familiar with the multi-tier system of support. This is truly, truly the foundation of how we think about addressing attendance. And one of the things that I wanted to say that we should keep in mind is that these tiers are additive, right? They sit on what we call foundational supports, which promote that positive condition for learning. So we're not just taking a focus on universal prevention for all students, not just for the students with good and great attendance, but all students. And then, when we notice this absences add up, we do that early intervention so that chronic absence does not become a problem. And then tier 3, of course, we know it's the most intensive intervention, right? So as we think about foundational supports and positive conditions for learning, we have these positive conditions that we know are based or centered around whole child, the whole family, strong relationships at the center, right? So when schools promote physical and emotional health and safety, when they promote that sense of belonging, connection, support, when we really engage in academic challenge and engagement and that curiosity for learning and that spark for our imagination, right? When adult and student well-being and emotional competence are demonstrated in our schools, in our districts, we know that that's a way to address chronic absence, to decrease it and to increase good and improved attendance. And so keeping the positive conditions for learning as a foundation or at our foundation, it would help us get to really good outcomes. The way we know how to address chronic absence is when we find out what the reasons are for missing so much school, right? Typically at Attendance Works, we consider the factors that impact attendance into these 4 categories, or 4 buckets. We think of them of barrier, aversions, disengagement, misconceptions. And I believe you're familiar with these. So as we think about what are the different methods of addressing chronic absence, we really want to keep this very focused way to address them based on the needs and the relevancy of our families and students. One of the things that we wanted to give you and just lift this up is the root cause analysis worksheet. Please notice that we have updated, and the questions in it are aligned to the positive conditions for learning. So if anybody needs to use this 2-page root cause analysis with really specific questions around the positive conditions, please use the link and use that in your schools with your families and with the students. And as we think about the year-long approach, we wanted to say, we know you have teams. We know that your roles are so integral to the way that we address attendance in the best way possible, right? So we wanted to recommend some steps and also give you a little bit of how we think about addressing this year-long approach. So as we wrapped up the spring, or we're doing that right now, we think about nurturing that sense of belonging, because we know that it's getting to the end of the school year, right? As we think about summer, and that's what's coming up for us right now, right? How are we cultivating engagement? How are we keeping the relationships and connections with students and with families at the forefront, so that on day one, it's not something new that we have to do, and it's not a process that we have to start, but it's something that we continue to build on, right? How are we thinking about creating community in the fall? We have new students, we think about the transition grades, we think about the special education supports, we think about all the responsibilities and tasks that are coming up, right? And then really throughout the year, ensuring that there is adequate and timely support as needed is going to help get us to those desired outcomes. So we wanted to pause for a minute to just help you think about this year-long approach. And we wanted to invite you to think back of this school year and pinpoint a day when attendance was at its peak. What factors contributed to students showing up and being eager to attend on that specific day? So let me invite us to share in the chat for just a couple of minutes. Would love to hear your thoughts. And if you want to come off of mute and share out loud, that's fine as well. Just want to learn from each other. Thank you. I see assemblies, field days, success assembly, field trips. Oh, sure. Those were fun. Global Play Day. Recognition breakfast. All right. I wonder if the recognition breakfast was with students or students and their families. Angela? Adventure Education Days.
Hi, this is Angela. It was students.
Go ahead. Yes.
It was with students and families.
That's meaningful. Thank you for sharing. First days of school. I see more comments. Concert days, whole school recognition days. Many students do not like to miss days when they have lunch group. Oh yes, peer connections are so important. Parent and school learning days, incentives. And as we think about incentives, right, we think about good and improved attendance, recognition, right? Supporting that piece. Wonderful. Thank you so much for sharing. These are definitely good to know and great inspiration for our colleagues. I see, Angela, one more thing. At the middle school and high school, big sporting events and concert days feature strong attendance. Absolutely. Right? Bringing in the fun associated with learning makes such a big difference. Continue to share your thoughts. I'll keep us moving just so we respect our time. All right. Thank you so much. One of the things that we wanted to share with you, just as a sample strategy that has worked really well, is from a cohort of districts that we work with in Detroit, Michigan. And they have developed this tri-county communication campaign. And one of the things that they have tried out last year and they're doing again this year is sending out a postcard to a student over the summer, to the student's name, not to the parents. And they will say, hey, I missed you so much, or I can't wait to see you in the fall. And these are just a couple of samples of the postcards that they developed. My favorite one is the Attendance Matters, where they actually clearly talked about how attendance is associated with a good habit and how they think about how they should think about good and improved attendance and with those colored bands. That's super helpful for families to see. So we wanted to share those as best practice as you think about the summer bridge. And then as we think about the year-long approach and how we plan, we wanted to invite you to explore the year-long planning calendars. So we have two different versions. One is for schools and one is for district. The link is in the deck and you will have access to it. And we wanted to say that these could be really good tools to use for both planning intentionally around the foundational supports, the tiered supports, and also about what the school team is actually planning to do in terms of actions and interventions, right? And the way the tool is organized is by summer, the welcome back, ongoing, and then the semesters, just because we want to be very mindful of having a plan in place and adjusting that. So one of our skills as a team, as an effective team, right, is that continuous improvement approach where we refine and better our processes for better outcomes. So we wanted to share these tools with you. And a reflection for your teams to take back is that we, again, encourage you to begin filling out the summer and start of the school year columns. And so we've created a copy, an electronic copy of the attendance plan for the K-12. And we want to encourage you to explore this with your teams, right? Team works really well, and everybody's skill and experience and expertise can be materialized on a document like this. And this could be a really good companion for your school action plan. Another thing that we want to share with you before I invite Elliot to join us is the communication with families. We know that this, especially at this time in the year, we think about how do we maintain that connectedness with students, the fun of engagement and with families. And so you've got a resource page here with letters for families, with staying the course, with holiday messaging, with really thinking about how and in what ways we could best support families with attendance messaging. And again, a support for readiness for day one. One of the things that we know is really a best practice, and this is at the core of the foundation supports, at the core of the positive conditions for learning, is a relationship map. Is that strategy and a tool where we think about who are the students in our schools and are they connected to caring adults that are sort of like their go-to people and are the people that encourage them to stay the course. And so as we think about the relationship mapping, we've included some considerations here for targeting relationship mapping as an intervention with a suggestion for reviewing students with chronic absence at different tiers, different groups of students, determining who is connected to school during the day, before and after for activities, identifying who are the students best positioned who have an existing relationship with the students and how they can build on that trust and support, and then always thinking about monitoring progress, right? So this is one way that you can think about relationship mapping. And then a few more resources for intentional relationship building, whether you are looking for a quick 60-second intervention or a framework that you can share with teachers. We've wanted to share these because these are best practices that we've gleaned from different districts across the country. And with this said, let me invite Elliot to get us going on health and attendance.
Awesome. Thank you, Emma. Can everybody hear me okay?
Yes, we
Emma,
can.
can you hear me? Okay, perfect. Okay. And apologies again that I can't be on camera. I'm traveling but excited to be here. And Christine, Kari, Holly, I just echo Emma's previous thoughts on inviting us to join and for making this possible. So I'm going to start with a slide that I came across a few years ago, which really isn't far from the truth for many of our kids in our classroom. Hi, we're every social problem in America that you can see rolled into a herd of too many humans for one mortal to manage, let alone teach. Where do you want us to sit? And you know, for many of our students, this image does represent the challenges they face every day, challenges that impact and hinder the learning environment. Next slide. So research shows a strong connection between chronic absence and health, and kids who are dealing with those chronic health conditions and even acute conditions are much more likely to be absent from school. And if a child is chronically absent from school, then it's a warning sign that maybe a health-related condition or a social determinant of health, such as transportation or lack of access to healthcare, might need to be addressed. And research also tells us that disparities between poor and non-poor children are already present when they start school. So the earlier we can intervene and provide the right supports and resources to addressing their health issues, the better the outcomes. Chronic absence is also a early warning sign that students may be off track for reading by the end of third grade, or completing middle school, or graduating from high school. Not earning a high school diploma is associated with lower life expectancy. And we also know that chronically absent students are more likely to have discipline problems and display behavior issues and engage in unhealthy activities. Next slide. So on this slide, we have some of those more common health-related barriers to learning, including asthma, behavioral health, vision problems, dental issues. And if you look at specifically asthma and dental issues being 5 times as common as asthma, but they are preventative. Both have been historically leading contributors to missed school days, and both are much more prevalent in poor socioeconomic areas. If you look at kids with poor oral health, they are nearly 3 times more likely to miss school. And then if we look at behavioral health issues, about 20% of children are affected by behavioral health issues, and that's only spiked since COVID. And sadly, due to the stigma and the barriers around access, many of our kids are not getting the appropriate treatment. And so it's really no surprise that kids with behavioral health issues miss 2 times as much school. And if school isn't perceived as emotionally or physically safe, then students may just choose to avoid school altogether. And bullying is just one example of this. Next slide. So I'm sure many of you are familiar with youth risk behavior survey data, and the most recent data, or actually looking back at 2021, shows that about 40% of students reported feeling sad or hopeless to where they just basically stopped doing usual activities. And females significantly outnumbered males. And then if you look at LGBTQ students, 2/3 reported similar concerns. And then this is all compounded by the fact that many students just don't feel safe. They don't feel connected. And with about 1/3 of students nationally saying that they didn't feel close to someone at school. But if you look at Connecticut's data, it's almost half of students. So where does that leave motivation to attend? And I think I just saw something pop up in the chat. Emma, will you let me know if anything comes up as I'm speaking? I'm
Yes,
sorry, I just don't want
yes.
to, I don't want to miss anything. Okay, perfect. All right, next slide. Thanks. So there's also a strong connection between mental health and academic performance, and students who report lower grades are at much higher risk for symptoms of depression and suicidality. One really striking finding is that kids who receive mostly D's and F's are almost 4 times, just over 3.5 times more likely to report attempting suicide as kids who get mostly A's. So I shared all this data, but I also want to share that, that on a positive note, we know that healthy students are much more likely to attend school. They're much more likely to stay engaged, and they're much more likely to be ready to learn. And these same students are more likely to graduate and to live healthier, more fulfilling lives. So a sentence I'm sure you guys hear a lot is that a healthy learner really does start with a healthy student. Next slide. If we want to improve attendance, we really have to take a whole child approach. And this includes making sure that foundational supports are in place. Policies, which includes policies around school climate and connectedness. It prioritizes prevention by making sure that we place a focus on health and physical education, that we're screening for specific health issues, and that we're making sure that resources are available. It requires that we collect health data and that need to know individuals have access to that information. And it also includes leveraging Medicaid dollars so that we can support evidence-based school health services and be able to sustain them. And every school should have a school nurse. And Connecticut has really done some amazing work in this space with nurses being connected to all of your schools. And as health experts in the school setting, school nurses coordinate student health needs and they keep kids in class. Who, if you remember your nurse from elementary years, say something in the chat. I definitely remember mine and was lucky to have one, but I won't tell you how long ago that was. So school-based health centers, they also keep kids in school, making sure that kids have access to comprehensive health services, from managing chronic health issues to physicals to vaccines. But having a school-based health center does not mean that a school nurse is not needed. They perform separate roles, but they complement each other. And as we saw from the data earlier, behavioral health services are also necessary And we need to make sure that we are creating trauma-informed schools that allow us to recognize and respond more quickly to behavioral health issues. And it also leads to reduced suspensions and improving attendance and overall school performance. And I've shared this before. I'm biased, of course, here, but school health physicians also play a tremendous role in supporting schools and districts in this work. Other best practices include community schools, home visits, employee wellness. You guys, sorry, going back to home visits, you guys have done some really amazing work in that space, and many of us are jealous. And it, of course, includes employee wellness, after-school programming, such as the arts and athletics. And if you've heard my dad joke before, still feel free to respond, but I'm going to throw one out real fast. What's an alligator's favorite after-school activity? And you can place it in the chat, and I'll come back to it later because it really reinforces a point that I want to bring home about after-school supports. Next slide. So schools obviously cannot do this work alone. We have to make sure that we align the intervention to the reason, and then make sure we find the partner to address it. And, you know, if we want to do this work successfully, we really have to have the right infrastructure in place. This includes having information sharing agreements that can help us make sure we're coordinating care as best possible. And if we make a partner referral, we need to make sure that we close the loop. It's easy to make that referral, but did we actually make sure the family got to that service? And then did we find out, is there anything we can do to continue to support that family, that student, to continue to get the right supports? We have to also make sure that the intervention is easily accessible. In my previous work with Detroit Public Schools, we worked closely with the health department and with Vision to Learn to do vision screenings and provide glasses to kids who needed them. And we realized that many of the kids were not getting the follow-up exam that they needed from Vision to Learn because they never returned the consent. And so 50% of them did not return the consent. And for whatever reason, getting lost on the way home, a translation barrier, a literacy barrier, getting lost on the way back, maybe a child was intimidated by wearing glasses or didn't want to get bullied, you name the reason. We started to look into moving to an opt-out process. And after a year and a half of going through all the legal teams, and we put it in place, and we went from 50% of kids who failed their screening receiving glasses to 98%. And again, I'm not sharing this story to brag, but it's really to stress the importance of making sure that our policies improve access rather than unintentionally hindering it. Next slide.
Elliot, can I just make a comment about that slide quickly? Go back. I just think
Absolutely. Please.
This slide is amazing and so important. And I get a lot of calls. I know my colleagues do at the end of the year about these students who are not coming to school. And we don't know what to do. And these partnerships need to be set up in a very strategic and intentional way, and not a response when you're faced with an issue that a child presents or a family presents. These relationships with your local pediatricians, with your mentors, your Boys and Girls Clubs, these can happen at the district level and over the summer. And there should be sort of a mapping out of what do we do if. This is work, a great example of work that can happen over the summer to prepare to be responsive instead of reactive at the beginning of next year. Thank you.
Absolutely. Thank you, Kari. Yeah, I mean, I've also been in schools where people didn't know about partnerships and didn't realize that they could be accessing them or had them right at the school. And so once these partnerships are in place, making sure that we are raising awareness about them and helping families get connected if they need them. So, all right, thank you, Kari. So next slide. All right, so please feel free to drop some answers into the chat. What successful health interventions through partnerships have you seen in your districts? And then what gaps are you seeing in health-related interventions? And we can chat for a couple minutes depending on responses. Yeah, I see school-based health
Mhm.
centers. It's so great to have school-based health centers, and obviously not every school can have a school-based health centers. But we are seeing a lot of neat work around using telemedicine to access school-based health centers, or using hub and spoke models where you have a center in one school and then you can refer to that center from surrounding school. On-site evaluations and counseling, absolutely. Kids are much more likely to take advantage of those services when they're on site. Yeah, long wait lists. So we'll talk a little bit about this in a few slides. The many times we see that there is so much going to tier 2, tier 3, and not enough investment in tier 1. And I'll talk about this a little bit later. But then all that ends up doing is overwhelming the tier 2, tier 3 services, which creates those longer lines. Yes, mental health providers, medical providers that speak different languages, absolutely. We need to make sure everything is, that we have access to translators, that everything is properly translated, that it's culturally appropriate, and so on. Urgent Crisis Center. Mapping, yes, absolutely. I think this goes back to some other things that Kari mentioned. Yeah. Yeah, youth services. I don't know if you're referring specifically to just getting youth more involved, but we are seeing a lot of work happening around peer-to-peer. Go ahead. Was somebody
Yeah.
going to say something? Yeah.
Yeah, I can help with this because in Connecticut, now it's probably many years ago, but over 5 to 7 years ago, we transitioned from referral to juvenile court for truancy to referral to a community provider who can help the family access services that they need. And it seemed to the leadership that the natural agency for this in many of our communities was what we call the Youth Service Bureau. And I think that's what this is getting at. So in our districts and communities, some youth service bureaus are stronger than others, and some communities don't have them. And that's why you don't wait until there's an issue and then you want to call your youth service bureau and say, we have an issue. I understand you're supposed to help us. That work has to happen ahead of time. And so that there's systems and structures in place for making those referrals. And if it's not the youth service bureau, who is it going to be in our community? Because the law requires that.
Awesome. Okay. All right. So if we can go to the next slide, please. And if I missed anything, just let me know on the chat. So when it comes to doing this work, we really need to be able to share health information. I think I touched on it briefly on a previous slide. It's really key to doing this work, and it allows for improved coordination. So I'm going to show a few examples. In Missouri, they developed a school nurse link where health plans have direct contact with school nurses in select schools, and that helps to facilitate communication and appointments with healthcare providers and specialists. At Nemours Children's Hospital in Delaware, they created a student health collaboration with school nurses where nurses have read-only access to the local health electronic health record. And they can see current medications, they can see a recent visit to the ER, they can see diagnosis and care plans, visits to a primary care provider or specialist, and they can help make sure that the family continues to get the right supports and help them navigate and further coordinate that care. So if a child was in the ER last night, now is in school, the nurse can see that note and visit from the ER and bring that child into his or her office and see how the child is doing. And that's just one of obviously many examples. And then at National Children's Hospital, they've developed the chronic absenteeism reduction effort, which has now spread to multiple other places, where healthcare providers have access to student absenteeism data, allowing healthcare systems and school districts to work closely together to get students back into the classroom and to keep them healthy and ready to learn. And these are just a few innovative ideas that organizations are using to help address some of the current challenges and barriers, and to making sure that students and families have the right supports to keep them healthy and in school. Next slide. So we touched on this briefly about the importance of understanding existing supports and resources. And this really can start by conducting a school health assessment. This slide shows some of the more common ones: the Healthier Generations Thriving School Assessment and CDC School Health Index. They both help schools and districts to identify strengths and then opportunities for improving current policies and practices. And then the TEAMS assessment takes a deeper dive into that's what the American Academy of Pediatrics. That takes a deeper dive into school health through modules that are focused on areas that you can see in the image on the right. And then last but not least is the school mental health quality assessment, which is really focused on improving school and district mental health systems. Next slide. So a needs assessment really looks at, which includes mental health and school climate surveys, can really help to identify what the needs are. It can help you determine priorities. It can help you then inform decisions. And while resource mapping offers an inventory of school and community mental health services, when you look at resource mapping though, that helps us look at what currently is in place. What is our inventory of services and resources that are available to supports and to students and families? But taken together, the assessment and the resource mapping can then help you to not only highlight your strengths, but also to look at your gaps in the system, and then can help you prioritize and plan how to move forward. So this slide really shows the complementary roles and resources of school districts and community partners in building those comprehensive school mental health systems. But as you can see, and we touched on this before, the community partner role increases as we climb through the tiers. And if we invest more in those tier 1 services, we're much less likely to overburden the system. We're more likely to ensure that kids who are referred to tier 2, tier 3 students are students who actually need them and are able now to get them. And we then address the bottleneck, which someone mentioned earlier. Next slide. So as you begin to think about the next school year, of course, we want you to take some time to breathe during the summer. Attendance Works has put together some immediate health-focused actions to improving attendance. And this starts with prevention. It includes making sure that relationships and healthy routines and habits, both at home and at school, are reinforced. And it also puts a focus on providing access to school-based health screenings like vision and dental and vaccines and behavioral health and housing and food insecurity. It also includes messaging on that on the importance of kids showing up to school on a regular attendance routine, and then also when a child should or shouldn't stay home. During the pandemic, we saw a lot of families struggle with when or when not to send their child to school, and a lot of kids stayed home unnecessarily. So we have to make sure that the messaging that we're putting out is evidence-based, and of course, as someone mentioned earlier, available in appropriate translations. And it includes making sure that attendance teams draw on different areas of expertise, which includes school health team members, allowing for early identification of a health issue and then helping to better coordinate care. And then lastly, excuse me, it also includes knowing the student body health needs and what impact they might be having and how they might be creating barriers to kids showing up to school, making sure that kids with chronic health issues and disabilities have health plans on file or education plans in place so that families feel secure sending their child to school and so that teachers can best support those kids. Next slide. So Attendance Works in collaboration with Kaiser Permanente and with the National Association for School Nurses. We've developed a few resources that can help put many of the actions on the previous page into place, offering guidance on how to keep kids healthy and in school, when or when not to keep a child home, how to identify and respond to children who may be dealing with anxiety, which we definitely saw increase post-COVID, And then excited to share that we will soon be launching a resource on chronic health issues for both parents and educators. And some suggested methods you can see on the right, suggested methods of sharing these resources from back to school packets, parent and staff meetings, and a few other ideas. Next slide. So do we have 90 seconds to play this? I have 2 slides after this. If not, we can share it in the chat.
Yeah, I think that's fine. Let's do that. We just need
Okay.
to make sure the volume is all hooked up.
It's not necessarily targeting individual kids. It's targeting when there are patterns present in your school community that are affecting large numbers of kids.
This kid's actually, and he is doing a lot better as far as getting to school. He's at 94% attendance.
I think the biggest systemic change was putting the attendance team together.
So devise the plan and then follow through, get the right people on the team who can move the plan.
Trust is one.
And then make sure
I
you
know
follow up,
that's
follow
right.
up, follow up.
Parents.
Our attendance team consists of our attendance clerk, our truancy officer for the district, the teacher on special assignment for our school, and our school psychologist.
Good morning. Hi, Bridgewater. Ours includes social workers, admin, and our student support person. And so then that expands to investing teachers who might have a relationship with the child to do the home visit or to do the outreach.
When I said I needed an attendance team, we needed to be able to work together on attendance, then everybody wanted to, join in. The nurse said, I'll do this. And the counselor said, well, I can do this. So that's when my nurse got in it and she started saying, well, I'll call parents and just let me get those that are missing or absent and I'll start calling. We'll see what's going on.
Awesome. Thanks for giving a chance to share that video. That, it just reinforces the importance of bringing in, making sure that there is strong representation of all the different needed individuals on attendance teams to be able to better do this work. And of course, highlighting the role of social workers and school nurses. All right, so next slide. So if we could take just a minute or so to get your thoughts on how is health included in your team that addresses attendance, and feel free to drop some thoughts into the chat. Sorry. Yeah, thanks for that comment, Carly. This is great.
Good morning. I'm sorry, I can't turn on my camera. So usually health is included in our attendance team to discuss, patterns, the same way that the video was sharing. One of the things that I have come in experience is that asthma and diabetes has been the 2 top that has been part of our conversation. Like the video says, we have made a plan on how to address those 2 health concerns. Similar, my experience has been like, identifying the students, ensuring that, and, the MAF forms are in place to, to be able to better support our families, and having the constant communication with parents to understand the health concerns that they have, because some families might express it, in that if there's no trust in the, between the school and the families tend to pull away or try to resolve this on their own. So during our attendance meetings, I usually, try to like see those patterns around health, like break it down even more, like what are those health specific concerns and what kind of, plans we can work around that. My experience has been working with our school nurse, which is a main big one, because they're able to provide that support and that guidance. And like the video says, right, that they're the ones that pick up on those cases and they go and call the family. And if, if there's anything that we can do as a school, we are able to step in and support. Just quickly, one example, we had a student who was constantly in the ER due to asthma, and the nurse was able to help us like with the family to understand medication, to understand the fear of the families as well, because they didn't want to send them to school right after they were released from the hospital. And it was setting up a plan, and working with the gym teacher because she couldn't be upstairs running, just putting all those interventions in place to prevent her, and to support her to be in school.
Yeah, that's amazing. We may follow up with you because I think we'd love to highlight that story. It's so great. You know, kids are obviously in school half of their awake hours, right? And the nurse becomes a trusted family source. Kids might see their doctor once or twice a year, and where you have a nurse every day in the school who gets to know the child and can help, talk to the family and set them at ease and make sure that they do get the right supports at school. That's huge. And so thank you for sharing that story. And we know that when nurses are in place, they definitely make a huge difference, especially for kids who have chronic health issues and getting those supports. And someone mentioned that it's difficult sometimes when the nurses are part-time in schools. Yeah, absolutely. And they may not be able to join every meeting, but hopefully someone is able to reach out to them when they see an issue around health where the nurse can support. And then it also goes back to the prevention piece. The more we can do around prevention, the less overwhelmed our health staff are, and then they can play a bigger role in those kids who need some of those tier 2, tier 3 services. So, all right, next slide. Thanks. So there are multiple organizations now that are having conversations around the importance of making attendance of vital signs. So when a child comes to the doctor's office, the first thing we look at is vital signs, heart rate, blood pressure, temperature. And if they're normal, we provide reassurance. But if we find something that's off, we take a deeper dive and figure out what the cause is. And then we work with the family to provide the necessary interventions. So knowing the connection between health and attendance, we also have to include attendance as a vital sign. If a child's attendance starts to drop, is it because of a health issue? Is there an underlying social determinant of health? Like food insecurity, housing insecurity. We talked about transportation, healthcare access. Is something happening or not happening at either school or at home that we can intervene and provide support so that we can help that child get back across. Next slide. So what are some ideas to be successful on that first day of school? We talked about some of these things already, but I just want to reinforce some of them from messaging on how to stay healthy, using back to school events, which we heard a bit. I saw some mentions in the chat earlier to help. And that's where you can help families connect with resources. During my time at the district, we worked closely with the health department to provide immunizations at enrollment fairs, making sure that kids were caught up prior to the school year and overcoming some of those challenges to access. We have to make sure that those school health policies are in place and that we're collecting student health information on every child, allowing us to ensure that the right supports are in place, especially for those kids with disabilities and chronic health issues. And then we talked about resource mapping, which can help identify and raise awareness around existing supports. But we also have to make sure that staff have the appropriate training and supports to create that safe and healthy learning environment. Keeping in mind that staff wellness should also be a priority. It's one of those 10 components of the whole child, which doesn't always get the attention that it deserves. But if we really want to take care of our kids, we have to take care of ourselves first. So I know I threw a lot at you guys in a short period. I think that's it for my part. But before I do hand it back to Emma, did Emma or Kari, did we get any responses to my awesome dad joke?
I didn't see any yet.
No, I didn't see
Alright.
it either.
Okay, so the answer is marching band. Marching band. All right. So, dad jokes, right? And if anybody
Right.
wants some training on how to give a good dad joke, I offer free services. But I share that joke I share it to reinforce the message of after school activities. The hours of 4 to 7 are when kids tend to get into the most trouble. And if we can offer opportunities for them to get involved, to become engaged, it might be their math teacher who's teaching that after school robotics class. and then they might develop friendships with other kids, and we know that after school activities are proven to engage kids and to be more, and those kids are much more likely to show up to school. So yeah, it's a dad joke, but there was a point behind it. All right, so I'm going to hand it
All
back to
connected.
Emma so
Yes.
that she can close us out. Thank you again for the invitation to be here.
Thanks so much, Elliot. We really appreciate your the wealth of experience and resources you shared. All right, we included the resource slide that Kari already shared at the beginning, so just so you have it in this deck, but I won't cover that. As we leave our time together, our hour together, we wanted to invite you to a webinar. Actually, we have 2 more of the attendance awareness campaign. The first 2 are on Teams, effective Teams, and we talked a little bit about that today. And then the second one was on health, well-being, and safety, and you feel free to listen to them. They are posted on our website. The 2 coming up are on student connectedness and family engagement. If you click the links, you can register. Even if you don't attend, they will be sent to you. So highly attended and free. So please take advantage of them. And then so we just wanted to invite you to some questions and answers at this point, unless Kari and Christine, anything else to share?
Yeah.
We'll wrap up with this.
Yeah, so we could take some questions and everything.
Mhm.
Just 2 last slides in the last minute that I have, but nothing big.
Do you want to do those before we go into questions and answers?
Sure, we
and
can-
then
let's-
we can go into what we're calling after hours today. We're going to hang out and talk about without the recording and just see if we can answer some questions and be here for you. Go
That
ahead.
sounds absolutely great. So before we go to Q&A, just one last plug, and I know I did this earlier, but our Talk Tuesday survey, here's the link again. And it does only take a minute or 2, and your feedback is so valuable. But last, we wanted to share, of course, our contact information. Again, this is our last Talk Tuesday of the 2024-2025 school year. But you might have things that come up or thoughts, suggestions, even over the summer. Here's our information. Please definitely keep in touch. Let us know. It is right here. And again, I'm going to take my slides down so we can just open it up to kind of a Q&A with everybody. But before we do that, we want to wish everybody a safe, healthy, happy, restful summer. And it's just, really that time to plan and think about the great things that are going to be done in the incoming school year. It will be there before you know it. But definitely take the time for you as well. We appreciated every one of you coming and engaging and being a part of Talk Tuesday this year. So I am going to take this down and we will open up Q&A. You could just put your comments in the chat, open up your mic, your video, whatever. We'll take anything. But for the rest of you that cannot stay, again, we wish you well. Thank you so much.